Good evening. I'd like to welcome everyone to the Board of Health meeting. It's Monday, January 12th at 6 o'clock p.m. Um, and we will begin with a call to order. Stephanie Granger here. Megan,
Here.
Joanne,
Here.
Dr. Gopal, Stefan,
Here.
and Michelle.
Here.
Okay, that's great. We've got everyone here. And our first agenda item would be open forum. We've got people on the meeting, but I don't know if anyone is here for open forum. This would not be to address any of the items that are on the agenda. Not seeing anyone, Ray?
No, we have quite a few attendees, which is always great, but not at this time.
Okay, terrific. So we'll begin then with review of our December minutes. I did not have any comments. Did anybody else have comments on them?
I did not.
Joanne? Thanks, Michelle.
I did. Hang on, let me get them. So just on the hotel motel paragraph there, um, I know we talked about trying to rename the regulations. I'm not sure that I said motel and hotel. I think I had something that was more like hotel, motel, transit, no, um, lodging, something like that. I mean, that's picky, but just listen to the tape. But the question at the end where it says Belanger also asked whether inspectors may enter occupied rooms. That wasn't a question. I was making a comment because in that section where it talks about inspections for complaints or something, it talked about going into, and my comment was we can't go into occupied rooms and, you know, to talk about the wording or something on that.
So would you like it changed in a particular way?
Um, I don't I don't remember exactly what I said, so I have to go back and watch the recording. But if you could, maybe I did say it. I don't know, but I thought it was more of a statement than a question. Right?
Ray?
We can
Sorry.
go back, Joanne, and we can certainly listen to it and add that it was a comment
Yeah.
instead of a question. That's not a problem.
So
Yeah.
should we hold off approving until that or just approve it with the change?
With the change.
Okay.
That's all I had.
Okay. Any other comments? Then does somebody want to make a motion regarding the minutes?
I can.
Okay.
I'll make a motion to approve the December 8th Board of Health meeting minutes as presented, with the included edits in the motel and hotel regulations section that we just discussed.
I'll
Sounds great.
second that.
Okay, motion made and seconded. All in favor. Stephanie, aye. Megan,
Aye.
Joanne,
Aye.
Stefan,
Aye.
and Michelle.
Aye.
Great, thank you all. And thanks for those minutes. Okay, so our next agenda item would be the draft motel hotel regulations.
So the regulations, we did receive comments back from land use, both for zoning and building. Those comments were added. They they were comments that they were more questions as to how many rooms that we would be inspecting, things of that, not necessarily anything particular in the regulation, no grammar, anything like that. So what you see here, we did speak with town council about calling them lodging regulations because we added rooming houses. They did strongly suggest transient regulations for as a topic heading for these regulations, but certainly that's up to this board. And so, yeah, if you have any questions regarding that, we can certainly help you there. We do also have an addition We're looking for July 1st of 2026 to start. I know that seems a little bit away, but what happens with these particular kind of regulations, we want to make sure we get a letter out to the 3 establishments here in the community about what's taking place with these regulations, give them an opportunity to oversee them. They need to be able to apply. In which case, Abby has worked really hard in getting the application together, but we do need IT to draft that in our permitting system, so that too takes some time. Once they apply, they do need to come before this board, and we will make sure that they come together, all 3 applications for public hearing to meet the Mass General Law. And again, that just to bring that to your attention, again, that is only a one time that they need to come for a public hearing to get their first permit. So that will take a little time. So we're looking for July 1st start, and we're looking at a fee with the breakdown of the market baskets of the 21 communities. And then to cover our costs, it would be a $200 fee, an annual fee for any motel, hotel, or rooming house. And
So
we would do a representative sample of the rooms, the total rooms that they have.
if it's a July effective date, they would come before us prior to July?
Correct. Yep.
Okay.
So we want to make sure we have enough time for the letter, the application. They would have in the regulation, I believe I don't have it right in front of me, but 30 to 90 days, 30 to 60 days to apply for that application, and then pay the fee, and then we'd have to make sure they all come in together for a public hearing.
Okay. Are there any other comments on so the proposal that was in the packet incorporated those comments from land use and, okay.
Correct.
And so the next step would be to have
Would be for the board to vote on the regulations.
Okay.
And certainly if the board decides that they'd like to change the title of the regulations, we're fine with that. That's why it still says transient regulations. Again, bringing those comments back, bringing it in front of town council one more time, they did strongly suggest, but up to this board.
I mean, I don't know. Well, it sounds odd to us. I guess if that's the best legal term, perhaps that's the way to go. Any other thoughts on this? Joanne? You unmuted.
I unmuted. Just a couple things. I'm going to start with good. The hosting platform in piece that you added in there, that was brilliant. That was excellent, because it really takes care of that piece that I was confused and concerned with about the register. And it modernizes it, because in the definitions it does talk about online and blah blah blah. So that was excellent. That took care of that whole piece. So thank you for that. I was struggling with the title. I'm still kind of struggling with the title. But we can go back to that. But there were 2 issues that I had brought up last time. One under definitions, and that was the bath linen. And I thought we had talked about using including but not limited to, because it says towels and then it says face cloths or something. So it doesn't mention bath towels, hand towels, just towels, and then you mentioned a specific towel, which I didn't understand. But it doesn't mention robes or other things that might be in there. So I mean, I would just add the included but not limited to, and because you never know, it's going to end up in a bathroom maybe. And the other one was the laundry piece. I understand. I think it's just, to me, and it could be just me, it's a little vague, because when we're talking about all the different categories of lodging, yes, obviously a hotel, motel has to have their own laundry services to do the laundry. But it doesn't indicate that. And when you're talking about, say, a B&B or a lodging house, or even I've been to some like resorts, places where they do have laundry facilities, if you're going to be there long term, that you can wash your own things. It doesn't address like what that laundry means. It's kind of generic. So those are my two comments, and I don't know what to do about the title. Well,
Would it, I mean, could we do, well, it's transient lodging and with hotel, motel, and like as in parentheses or something?
I don't know. I don't know if it's just me. I don't know. Ray, like, what do you think?
Yeah. Oh, go ahead, Megan. Sorry.
No, you go ahead first and then I'll just say it.
I mean, do we love the title transient? No. It would make our lives easier if it was lodging regulations, maybe motel, hotel, and rooming underneath. Um, that would probably make it a lot easier for us, and I think for the general public as well. So, but again, we're okay with what the board decides. I know, looking up transient, it does, its definition is a temporary stay. And I think that was their overall goal, was to look at for all three. That's the case. But
But if
certainly
we
up to you.
listed them out, then that would be okay, you think? If we just said,
Yep. Yep, we could certainly put it under parentheses underneath the overall arching heading.
so it could say, what was your, wait,
And we can double check that with the laundry piece if you want to do that. We did ask about the bath linens, and that, that was something that town council was to add. So if that's not in this, we took out all the redlining. We can certainly add the laundry piece and then bath linen, as well as change the title to lodging regulations with hotel, motel, and rooming.
I think that is clearer to everybody. Anybody else, members of the board, have any thoughts? Does that make you feel more comfortable, Joanne?
Yeah, title wise, because I think it could become confusing.
Yeah,
I don't know,
it's
just as
not the
my thoughts.
common
And I don't
usage.
know if anybody else had thoughts about that laundry piece, but I just wanted to make it kind of clear that the difference, because there is a difference between being in a hotel and being like in a long-term stay where you can do your own laundry, or a B&B or something like that. And what you want them to provide, you know.
What is it that it currently says on the laundry piece?
So yeah, I
And then
agree with the about the laundry. I feel like the whole purpose of a regulations is to make sure that you can go in and regulate without a problem. So I definitely think we should go with what council recommended. Because I mean our and if we can add wording or whatever, then fine. But I mean it's not a humongous business in Westford. I feel like if people want to start or are going to be doing it, they either know what they're doing or they're going to be going and asking you guys how to do it anyways, right? I mean,
that's correct. And I could see where currently it's not the case here in the town, but I could see a possible bed and breakfast or rooming house or even a hotel subcontracting out for laundry, um, which is certainly a possibility as well. So,
Yeah, because it's written, it says laundering facilities shall be provided for washing bedding, bath linens, and towels. So it sounds like all of these
Would have
different
to be on site.
categories have to provide laundering facilities, the way it's written. And provide, have detergents and sanitizing agents. That's how I would see it.
Yeah, so was there wording that we can use to expand that?
I think, maybe just kind of think about it a little bit as in terms of what you're trying to ask for. So basically, this is how I look at it. You're trying to add into the regulation that the facilities will wash, the bedding and the linens, and that they have a mechanism in order to do that. for things like hotels and motels where it's, that's kind of a standard thing.
And that
But
if it's on site, it meets that level of regulation.
I'm sorry, what?
Well, that if it's on site, it has to meet that level of regulation, that it provides all of the things that it had listed there.
Right. But it could be construed as saying you have to do this.
Right.
So someplace like a small B&B, I guess my confusion is it for the facility or is it for the the patron?
Facility?
Our,
Right, but that's what I'm
yes,
saying. It's kind of, you can't.
Ray,
our understanding is the facility needs to provide laundry service.
So then that's the wording. That, somehow it has to be
so
specific to say it is about the specific facility doing this work, not the availability of somebody staying in a rooming house. Does a rooming house have to provide laundering facilities to their customers?
According to the regulation as written now, yes.
But the way it's written, they'd have to provide it to the same person at a Marriott.
and they don't all provide that.
No, it's the facility has to do the washing, not the patron.
Okay. So Ray, if
That
we
makes
wanted
sense.
those things changed, then what does that do to your process?
We can bring it back. We can bring it back and make sure that it spells out for both. Our understanding, like I said, is that they have to provide the service. And what that looks like for a bed and breakfast might be that they provide um, the laundry equipment. It might look like for a hotel, it's laundry equipment, but they do the work for you. They clean the bath, the linens and whatnot, so that they provide the service, but not necessarily doing the work. In a case like a bed and breakfast or a rooming house, they might provide the washer and dryer, but in a motel or hotel, they might have a staff that do that for you.
So can we get KP Law to spell that language out better that way then?
Sure, yeah,
Is that, Joanne, what you're looking for?
Yeah. Does that make sense to everybody? It's not
it
just me
does.
being
Yep.
confused.
Megan?
My only question, because yeah, I was confused reading it, whether or not it was here's the washing machine, or if it was a service that had to be provided, and where you bring back the cleaned product, right? But I guess my only other question was it left vague intentionally so you can go in and say this wasn't done properly? And so that was my only question. Do you think, was that written vaguely on purpose?
I don't know that it was written vaguely on purpose, except to, I guess, leave interpretation open. If you're in a bed and breakfast, they provide the service, meaning they provide the washer and dryer for the patrons that come and want to wash things. But in a motel, hotel, they also provide the service, but they may have a staff that will actually wash your clothes, your sheets, your blankets. But I think we can clarify the language so that, it meets the expectations of the board and for interpretation in the field, certainly.
Okay.
And a lot of the language is always taken from other model regulations for the state. So, yeah, we can change it. We'll bring it back and we can add the bath linen piece and then change the title. See if you like the way it looks.
Yeah,
Okay.
because I'm thinking like on a small B&B where it's owner occupied, so they may have the laundry in their private area and they don't want people in there. And so it would be a hardship if they were like, if it was interpreted as, well, you have to provide this for them, so now you have to build a separate laundry area. I'm just
Right,
trying to,
not all places provide
no,
guests access to the
guess
laundry.
that, yeah. So I mean, but it's obviously standard in hotel and motels. People, housekeeping comes in and does the laundry. Some of them even have laundry services. They'll take your stuff out to the dry cleaners or whatever. But um, I'm just saying, it's just because there's so many different levels of lodging.
Okay.
No problem. We'll take care of it.
Were
Can
there
I
any
ask one
other
more,
thoughts?
one more
One
thing?
more. Okay.
The fee. Are you proposing a flat $200, whether it's a 3-bedroom B&B or a 200-room Marriott?
We are. Now, if you want us to, well, now that was looking at, like I said, 21 communities of how they conduct their fees. That was for rooming, hotel, motel, and bed and breakfast. They have a flat fee. So if you want us to break it out, we can certainly do that. That's not a problem for us. But we had to base it on an overall average of time that we'd spend. It's the same if, we have some people that have frozen desserts. Some people have a very large facility here in the community, and some people have, they might just have soft serve in their hamburger restaurant, but they all pay a similar fee.
Well, I was thinking more like the difference between a mom and, a little convenience store or the gas station convenience store and going into Market Basket. It's very different. So that's how I was thinking of it in terms of your inspectional time. Um,
Yep, we can break it out by bed and breakfast, or unless you want us to break it out by rooms.
Have other towns done it? They're all just a flat fee.
yeah. I just find,
I
I'm
get
just
it.
you. I don't have an answer to that because this is the first time we've heard what the proposed fee schedule is. But maybe have a think, um, and think of it more like food. You know, risk base takes longer, it costs more than looking at chips. Kind of, it's
Or
it's gonna
time.
be it's gonna
Yeah.
be more work in a bigger facility than in a smaller one. And who knows, maybe the smaller ones, because they're not, a bed and breakfast, that may take longer because it's not a corporate that's running a, big business, and there's a lot of education that has to be done or things to be fixed. I, I don't know how right now, but I can think about it. But I think it's worth, your time is valuable, and
Mm-hmm.
you should be compensated for it.
Okay, yeah, no problem. We can certainly take that back too.
We could also, I mean, I don't know if you have any record or idea of how long you've spent at the various inspections, like how much it varies.
So we do, we break down the fees by time spent for both the inspection, re-inspection on an annual basis. This would be an annual inspection, and we break it down right down to the ink in the computer, the time it takes for the secretary to process the permit, the hourly rate, driving time, all of it.
So do you see a difference between the small and large?
We don't, other than one might have more rooms than another. At the end of the day, we're doing a representative sample of the total rooms that they have. So, um, the services that they all provide, whether, you're checking the laundry for all of them, going over paperwork, going over the requirements of the regulation. Um, I
So you
think
think
for all of our fee categories, there are certainly outliers to others, and we take an average. And so, but again, we're happy to look at it to see, whether we can break it out by, will it be any different if it's a bed and breakfast for time and coverage costs to hotel and motels.
I guess, I mean, I think that would be my question is, yeah, if you've seen a difference
Hmm.
through your history, then maybe it is worth it. If it comes down to relative similarity, then the
Yeah,
two.
right now I would say the time is the same. However, we're not in hotel rooms. We're not in the rooms. So right
So
now
this
we're
is
in there
added,
for food and, yeah, for other things, pools, things like that.
but this would be adding that.
This would be a separate piece. Yep. So they'd be paying for a food permit, a motel hotel permit, in some cases a pool permit.
And now a lodging.
Yes.
Okay. So they're already paying more, the larger places, because they have to pay for more permits.
In some cases, yes.
Okay. I mean that's an interesting, yeah, if basically the time is similar because their extra costs come from additional permitting for extra time doing those things, and that kind of explains perhaps why it would be similar. But take a look. Yes.
We will, we will.
Okay. All right. Any other comments? Sorry to send it back to you, Ray.
Nope, that's okay. We want to make sure it's right. So,
Okay. Then with that, our next agenda item is the update on the multi-family dwelling units at 219 Littleton Road.
so we wanted to bring this to your attention. This location, 219 Littleton Road, is the Westford Regency, um, or former Westford Regency. So, I did go out a couple weeks ago to do a final walkthrough and inspection, with some of our staff. We did walk through with the new owners as well as the property management company that's been hired, to make sure that we had a whole list of items, everything from hazardous materials, dumpsters to be emptied, kitchen, grease traps, things of that nature. So we did go out. We did go out for a final inspection too to make sure everything was completed. We're working directly with the building department, land use. We've sat on presentations on the new, I believe it's 300 units we have here. 300 units. So two buildings, 300 units, 30 affordable units are scheduled to go into this space. Um, we have gone through all the asbestos and demolition requirements. The building will be secured and fenced until the summer of 2027, when they're looking to demo. So we have made sure there's a property management company, that there's no hazardous materials, pest control, contracts have been set up for the property. And I know this board has mentioned in the past when, a large subdivision or a multi-unit family location was going up that you wanted to be made aware of that. So Abby has provided comments as we do for all new projects coming to town. We're given an opportunity as this board, if any comments that you'd like to provide. We too have provided a series of comments, letting them know they need a pool permit. We're working directly with DEP to make sure the wastewater treatment facility has been closed and permits are reached for the new proposed facility. So happy to answer any questions you have, or if you have any comments you'd like us to provide, we can certainly do that.
So you're saying demolition isn't scheduled until summer of 2027?
Correct.
That's a long
I
time
thought
for
it might be this summer. I thought it was 2026.
They were talking about 2026, and it appears that may be carried over for some time, but they are required from both building, land use, and this community and this department, excuse me, to make sure that the building is secured and that there's a property management company contract that stays in effect to make sure, again, there's no mold issues. It does have to be heated. It does have to be, the Ansel systems have to be working for their sprinkler systems. And so fires involved, police, monitoring of the facility is also taking place.
Does the existing septic system apply to the new construction, or are they going to need to have a brand new system put in?
They do not need a brand new system at this time. Where they are still working, the new owner is still working with DEP on the new design. Right now, the current system is closed, if you will. It's what they call closed. It's been emptied. We've been following the site for well over a year now. They were pumping anywhere between 10 and 20,000 gallons of effluent per day out at the site. So we are working closely with DEP to make sure that the new owners will need their own new groundwater discharge permit for the septic system. Whether they'll need additional leach fields or new leach fields or new tanks is yet to be seen.
Well, it's more room or more residences, right? Than it's a large
No,
place.
I don't have that, Abby. I don't know if you know how many existing hotel rooms. I know they had well over 250.
I think it was an increase in flow.
Was it?
Yeah.
Well, and it'd be more permanent, so it changes it quite a bit in that.
The new location will have a pool. So, we look at everything from the discharge from the pool. We look at any, will they need additional permits, food, hazardous materials, and trash disposal, um, and how the units affect. How does the surrounding area affect this community as well? And so in the packet, you saw not only their application, but they had a figures plan of showing what they're going to have, how they're working with conservation, have, natural playgrounds and things of that nature. We do also, it's outside of our regulatory requirements, but we do also strongly encourage sidewalks. We encourage, connections to trails. So we are looking at not only health and safety, but making sure that, folks are connected, like I said, to the community.
Good work.
Just a comment though, the plan looked impressive, when you look at all the pictures, but I'm thinking of the density in that area. Is that, and I didn't go through the 54 pages of their application, but um and out of curiosity, I know it's not us, but still, like you said, sidewalks. So safety from that aspect, kind of does when we talk about um, urban development. So green space, all of that. Um, I don't
This is
know.
really new to Westford to have
Yeah,
so, I mean, talking about what would be there on that corridor, that's a lot.
it's a lot. Yeah.
Yeah, we certainly do. That's why we not only do we review the comments, but we do sit in the meetings that they have when they come to present on the proposed project. They take all of our comments, then they come back again. We provide more comments. Um, just Joanne, to your comments about the density, we do ask things about, for instance, I asked a question about lighting. Not only do you have one group that's concerned about light pollution, but you also have a group of people that are concerned. They want to make sure that the sidewalks lit up at night if people are walking. Are there benches for their community that needs to sit down? It's a full mile around. Um, and so, again, the green spaces are important and playgrounds and, that full health, community health is important. And we're also looking at environmental health for, detention ponds and the septic system and effects.
Mhm. Yeah, that's a busy, that has really, in my time here in town, from one stoplight to whatever that is down there at the corner of Boston Road and 110. So it's a lot.
Yeah, it's changing a
But
lot.
yeah, it,
Yeah, I don't know if you have any comments, Abby. I will say, feel free to pipe in, but, we do just so you're reassured too that I think we brought up at the previous meetings that a hydraulic water study was done on the site. We do ask questions about what they're going to be doing with the irrigation wells. Are those going to be capped? Are they going to be for irrigation? Hazardous materials right down to the spray they're going to use to de-ice the sidewalks. So, those are all questions that we do make sure
So,
we ask.
sorry, when you're saying the water, I mean, again, that's not entirely us, but it is going to be an impact if, we're constantly being told we're in watering um, bans because we don't have enough water and we're adding all these new facilities. Are they allowed to
Are they
do,
wet?
are they allowed to use like,
Mm-hmm. Yep, there are no restrictions for anyone that should come and build here in the community with
but if
regards to
they're on
water.
well water, does that exempt
They're
them?
not on well water. They'll be
They
on
will not.
public water supply, which is fed by wells here in Westford.
Right.
Um, but their private well on site is an irrigation only well. at this time. I don't know what the new project at this time. They have stated they do not know what they're going to do with that well. It won't be used for public water supply, but they're not sure if they're going to cap it or apply for it to be an irrigation well.
Think they are planning on, yeah, doing an irrigation well. So
Most likely, right?
yeah, according to their most recent submittal, they're putting one in. I think it might be for like the garden and just general irrigation, but they are planning on doing one, so we'll make sure that they're permitted and then tested properly.
Thank you. Any other comments or questions on this? Okay. Then we can move on to our next agenda item, which is the variance request for the Middlesex County 4-H Fairgrounds food permit fee. I didn't quite understand the document that listed like the four things on it.
Abby, do you want to speak to that?
Sorry, yes. So basically, I mean, 4-H, as you'll probably remember in previous years, has requested a fee reduction because they have separate permitting fees. So that said, like, I think it was $1,000 would be their total for their 5 kitchens for their permit. And then we looked at the breakdown of how much it would cost our department to do the inspections and drive out there. So that was kind of our like little fee analysis, what that document was. So I calced it out at right at like $200 basically. I think it was like 198. So that was just kind of to show the board like, just a ballpark of our time. I wouldn't go anywhere less than that personally. I would try to shoot a little bit over just in case we have to do reinspection. So that was the purpose of that other small document to show the
Okay.
analysis of our costs.
So if you have to do a reinspection, that isn't an additional fee, it's all included in the.
Yeah, we give a first one. Yeah. And sometimes the thing with last year is, um, sometimes they're not opening all the kitchens at once. So we went out there, I think like twice. So yeah, if they fail like one reinspection, then we will charge, but they get like one free basically.
So, I mean, I think I have a little bit of an issue with them asking you to only charge a single fee if they're not all ready to be inspected at the same time. I think that's not acceptable. So I can see doing a reduction if all are ready to be inspected. But if you have to go out because some of them aren't open, then that's a separate inspection.
Yeah, the problem is that's the issue. We don't usually know that until, like the process of them applying and scheduling inspections. So that's what makes it tricky. So I
But
think
don't they know that?
trying to account for that, um, they might, but I think things happen, during the year of who's opening what when and what kitchens they're using. So I think it kind of depends on usage of their facility and the rentals.
So on average, you would say you have to go twice.
Yeah, that's what it was last year for me. Yep.
It's generally not a one and done.
Right.
So
It's either a
For
re-inspection or
any
another
seasonal
kitchen.
place, nothing against 4-H, but it's
Yeah.
not,
yeah,
any
Right.
seasonal opening is never 100% ready.
okay. So I mean, I would say then maybe 400. If if the cost to go down once is calculated at 2, then and you're averaging 2 visits, I don't see why we should reduce it so that we're not covering the costs.
I would agree. I think there should be a fee per site visit. We can certainly reduce it from 1,000, but if they can't get their act together and get it all done on one day, then there should be a fee for each day.
So we can, oh, go ahead. Sorry.
Joanne?
Well, I know I was thinking about it too, having history, it's an every year event they come for a reduction in the fees. And, I get it from the standpoint of being at the 4-H, but, at this point they're, at $200, that's an 80% reduction. And, I know it's one thing to say, well, it's a couple miles down the street, and it only takes a couple minutes, but what you have to do for staff wise is then rearrange your schedule. You're putting somebody else, you know, moving somebody else around so you can do this. So it's more than, to me, just, well, it's so much per hour and it's 50 cents per mile, and there's a lot more to it than that. And I don't know. For me, I think an 80% ask is a lot. I was thinking more half, like $500. We'll give them a 50% reduction. Okay, if you have to go back once, it's covered in that amount, or 3 times, whatever, 4 times if it's 2 different kitchens that you need to go to twice. You don't know what's going to happen in each season. And I think we've been more than generous over the years in giving them a reduction in their fees. And I think that's appropriate to do, but maybe not to that huge extent that they're actually asking.
Thoughts from other board members?
Do we know what other towns charge similar situations? No.
No, we don't, because
This is sort of
the
unique.
fees are the fees, right? And they're all set on, in this case, food establishment fees to cover our costs. We only have a handful of places that come each year for variances for fee reductions, and it's less than 5, as you know. So we don't. We just try to
And it's a
figure
unique
out.
place.
Right.
It isn't like
There's multiple seasonal buildings on the property, and they don't all open at once, depending on the year. And so we do have to go out sometimes several times. And then if something's not ready or the hot water's not on, or, and that happens too when you have a voluntary board and, nonprofit.
So I guess my question is whether you think it would make more sense to just say we'll reduce it 50%, or whether it makes more sense to say we'll reduce it to 250 per visit.
I think 50% is fair.
Okay. I think that, I mean, especially given the history and the amount of time it's taking and the number of visits and stuff, it would be more reasonable. And that in today's market is, you feel the cost, but also costs increase is your cost to do this service. Are there thoughts from board members? This would be a motion, Dr. Gopal.
I think it sounds good. I don't know how to phrase the motion, but I'd make a motion that we rebut back with offering 50% reduction in the fees, which I believe would be the equivalent of $500. Is that sufficient
I
in a
think so.
motion for the
The
4-H
4-H.
reduction request response?
Okay. Motion made.
Can I
Megan, do
ask
you have
just a
comment?
quick question?
Yeah,
Sorry.
absolutely. No, that's normal to be able to have a moment between too.
So we're saying 500 flat rate, and so you're not going to charge more if you go out multiple times.
I
Correct.
mean, if we had like an issue, like a reinspection, we would charge a reinspection fee. But I mean, truthfully, we've got it like a couple times usually in the season, but they have really done a great job, I must say. I think that yes, in extraneous circumstances, we would charge a reinspection fee, but personally, I think they have done a good job in the past, and I can't see that happening. But we do have the capability if we have to.
So, but the reinspection fee would be at the 200 for the particular kitchen that had an issue, or
Yeah, we would charge the fee for when we would need to, just like any other establishment.
Okay.
okay. Is there a second then to the motion to reduce the fee by 50% for the 4-H fairgrounds?
I'll second it.
Okay, motion made and seconded. All in favor, Stephanie Granger, aye. Megan,
Aye.
Joanne,
Aye.
Stefan,
Aye.
and Michelle?
Aye.
Okay, thank you. Okay, so our next agenda item is the Kratom regulations discussion. Ray, I will turn it over to you. I watched the training that you sent. That was very interesting. Did some other research as well. I don't know. May I ask actually of the board members, did anybody else have a chance to watch that presentation? Joanne says yes. Okay. Okay. Just to know
Looked
where
at
we're
the
all
other
at.
materials, but I didn't watch that video.
Okay. Yeah, just to have a
Same.
sense of where people
I,
were. Okay.
yeah, I looked at stuff, but I didn't get to watch
Well, a
them.
lot of it was in the slides that Ray shared as well, so that's good. Okay, Ray, we'll let you talk for a moment here.
No problem. So, here in the community, recently we had an establishment that was selling kratom in pill form. And so what has taken place is a couple of the inspectors that conduct our tobacco inspections brought it forward and asked about our local tobacco regulations if it included kratom. Is the tobacco partnership that we have here in the community. Several other health departments sit at that table and asked if Westford had kratom regulations, if several other communities had regulations. And as the discussion went, there are several communities. I believe there are between 8 and 10 communities here in the central Massachusetts that have recently banned kratom and have local regulations to do so. So that has brought up a conversation, and for our department to do a little research to see what communities have and why, to learn about kratom. It's been around since 1831 as whole leaf kratom, and certainly synthetic chemicals, as you can see by the packet, have been added to the product. I will say, I do have that right here in
We
front.
talked to Cheryl a little bit about this too, I think.
We have. So Cheryl Sabara came, I believe it was a little less than a year ago, to talk to us about synthetic derived products. For instance, drinks and whatnot that have CBD in them. And she did bring up kratom at the time, if that's something that this board would be interested in learning about. What's difficult is a lot of health departments don't have the capacity to go out and do inspections to look at different products that contain kratom or 7-OH. And so I wanted to make sure that you saw the presentation from Linfield was attached, and then there was a recent PowerPoint presentation put on scientist, one of the top 2 scientists in the world, as well as a father who lost a son to kratom. And so I wanted to make sure you got to see a little bit of both sides of the fence on kratom. Also, there are some bills in front of Massachusetts right now for banning kratom. I will say that what we're noticing from just doing our research is that it can be in liquid shots, it can be in soda drinks, it can be pill form, powder form. Sometimes in some places it's sold behind the counter, some places it's sold um, right there in the gas station or convenience store. I am not a kratom expert, so I just want to put that out there. I gave as much information as we could find, the latest news articles. There's quite a bit from the FDA that was attached in the packet, and as you click on that information, you'll notice that will also take you down a research rabbit hole of more and more information on kratom and the chemicals that are added. My understanding is whole leaf kratom does have medicinal effects that can certainly help people. However, it's not regulated is our understanding from our research, and that's where it becomes difficult. Trying to have someone, a staff person, go in and look at different products and decide, is this okay? Is this have 7-OH in it? Does it not? Can certainly be a challenge for us. As you know, we contract out for tobacco, and I did check to see if that's something that they would be able to check while they're already in some of these shops. But they just don't have the bandwidth to do that, and we just don't have the budget to hire someone to do that. So, again, it's an herbal extract that comes from an evergreen tree in Southeast Asia. It's sold at different gas stations, smoke shops. It can be found in liquid form, pill, gummies, things of that nature. It can be advertised as an energy booster, a mood lifter, pain reliever, and remedies for quitting opioids, according to the Mayo Clinic. Kratom is often used by people seeking relief from opioid withdrawal, and experts say it does come with a risk of addiction, which certainly is a problem. In low doses, it can provide an opioid-like effect. Um, it's marketed in different forms. And from Northampton, which recently banned kratom on September 30th of 2025. It poses serious public health concerns, including potential for addiction, adverse physical and mental health effects, and in severe cases, death. Synthetics, which are added to this product, which are significant, they can provide 10 to 100 times more potent, have unpredictable effects, and they're currently unregulated, making their risk to consumers greater. Synthetic kratom products may contain altered or concentrated alkaloids or be mixed with other substances that are harmful and have fatal outcomes. So those are just some of the things that we've pulled. As you can see, there was quite a bit in the packet, which made the packet quite large. But tonight we wanted to be more of a discussion, and we did receive lots of emails from residents and folks outside of Westford, which you can see here. There's quite a few attendees that probably want to speak tonight. But I did just want to mention to the board that for us, it's about bringing the topic to the table to have a discussion. And if this board decides they would like to see kratom, a draft of kratom regulations in the future, that's something we can certainly work on and provide. Okay.
Thanks, Ray. It's definitely something that I have been concerned about since it's come on the radar. The challenge right now is new things keep popping up and faster than, I mean, from, doing some of the research and reading some of the materials you provided, the fact that the synthetic forms of this, really, it's only been a couple years, but the challenges and the problems that are the addiction and the issues resulting from it and the uptake is so dramatic in that short time. It's really an interesting issue. Should we open it first, perhaps, to community members who would like to speak?
I'd be interested in hearing Dr. Gopal's opinion on this.
Do you have one that you'd like to share, Dr. Gopal, at this time, or not yet?
I don't, I mean, I think that we should listen to what people have to say and then talk about putting forward a regulation on it. I mean, I, I always say more than I should kind of thing. I'm looking at the Drake it one and I love that one. So that's where I stand. So
Okay,
there's my cards.
great. I don't have them all up in front of me, unfortunately. I need more screens. Um,
Sure. So we can certainly start taking comments if you'd like. I don't know
Yep.
if you want to let people
Yeah, let
know
me
that.
lay some ground rules for comments. I will ask, in terms of board members, this will be a listening exercise. If you have questions about clarification, direct them through me, please. I'll watch for your hands. And for those who would like to comment, we'll limit the time to 2 minutes and also ask that you share information that has not previously been shared. If your comments are just going to be to repeat something that has already been said, we will ask you to please stop. Joanne, did you have a comment?
I would also ask, Madam Chair, that they identify themselves with their name and their address so that we know, and affiliation, if they're affiliated with anything, so we know who's speaking to
Yes,
us.
thank you very much. Yes, please also state your name, your address, and if you have an affiliation because you're representing a group, we'd like you to share that with us as well. I will say that I, received quite a few emails, I believe all from non-residents, sharing their thoughts and concerns about kratom over the last week. So clearly the issue gets out there as so with that, I guess maybe Ray, we can hold on. I'll put my timer up.
Sure. So the first person we have is Holly. I'm just going to take them in the order that the hand came up that's on our screen.
Okay.
Good. Holly, are you there? Okay, next we have John.
Yes, can you hear me okay?
Yes, go ahead.
Yeah, my name is John Shenholzer. I'm the Advocacy Director for American Veterans for Kratom Safe. And, I'm just going to try to address some of the things the lady had mentioned. I'm going to start with the Mayo Clinic. They've never done a study on kratom. They're under contract with the FDA to mirror what they want them to say about kratom. The FDA has a bias toward kratom. They don't like it. It's a plant medicine and it interferes with their, the FDA monopolizes drugs. Now, kratom is very, very safe. And I'm a natural kratom advocate, not the chemicals. Anything that's not natural, you should ban. That's my opinion and my belief. Our recent uptick in problems is a direct result of the chemical products, the 7-OH products. They putting all kinds of stuff in it. The American Kratom Association, their vendors use the FDA regulatory guidelines for good manufacturing practices. These products are tested, they're third-party tested, and they have been proven to be safe. The kratom, you got to realize in your community, they're not going to come in there and testify because it's been so heavily demonized. But there are millions of consumers nationwide who use the natural kratom product safely and they don't abuse it. And where you get a problem is when people they abuse it. And these packages, they all say right on the package not to exceed, X amount per day. So the safety profile, the FDA, they did a human study on it, and it has been proven to be safe. John Hopkins is doing clinical trials right now and have been doing it for a couple of years. There's over 600 scientific studies, over 200 peer reviewed.
I'll ask you to please wrap up.
Okay, well, just wanted to hit on some points there. And regulations are good for natural kratom products, ban chemical products. Thank you. And if you have questions, I'll hang out.
Okay, thank you, John. Michelle, you had a hand up?
Yes, I was just wondering if John could identify himself as to whether or not he's a Westford resident.
Right, John, can you share your residence?
Yeah, I did say, I live in Virginia, and I'm
Okay.
the American Veterans for Kratom Safe.
Okay, thank you.
Thank you.
Yes, so please remember name and where you live. And we were going to try and get Holly up for again.
Holly?
Hi, can you hear me now?
Yes, Holly.
Oh, I'm sorry. Yes, this is Holly. I apologize.
And please tell us where you live.
I live in Drake, Mass.
Okay.
I'm just here because I'm a lifelong resident and 20-year educator of Drake, Mass, and I lost my son, Tyrell, on February 6, 2024, my only child, my 25-year-old son, to metragenine toxicity. He drank kratom seltzers that were marketed as caffeine-free, sugar-free, and alcohol-free. It was no sole cause of death, no secondary causes, nor opioids or any underlying health issues in his system. You're going to hear from a lot of people, from lobbyists or the kratom industry who make a profit, or people that use it. I have nothing to gain. My son is dead and I can only visit him at a cemetery. Just so if you're not aware, it has the addictive property of opioids. Regulation by age or the synthetic 7-OH is not going to work, because the majority of deaths, if you study, are between 25 and 40, and they're males. And when you take metragenine, it breaks down into the liver into 7-OH. So the more metragenine you have, the more converts into 7-OH. I want to let you know that it's 14 towns in Massachusetts that have banned it completely. That's Billerica, Kingston, Northampton, Lowell, Chelmsford, Drake, Bourne, Canton, Westboro, Marlborough, Marshfield, Medford, Mashpee, and Belchertown. I also got a phone call from the chief of police in Littleton, Matt Pernard, a couple months ago, and he is looking to ban kratom in his town as well. And that's the town right next to you, as his brother-in-law overdosed from kratom, and he reached out to me. So I just, do want to say that whole leaf kratom, metragenine, does kill. There's my son's died from it. There's no testing. A board of health, they struggle to be able to regulate that. And honestly, just lastly, Mass General Law says that the right to engage in business yields paramount to the government's duty to protect the people. The lack of information, warnings, and general ease of access to vulnerable populations show a need to ban this product. And I just wanted to
Thank
add
you,
30.
Holly.
Thank you very much for your time.
Holly, I want to say I'm so sorry for your loss.
Thank you. Thank you very much.
Michelle, you have your hand up.
Oh, I think that was from the last question.
Okay.
Sorry.
All right. Thanks. Thank you, Holly. And yes, my condolences. And thank you for your comments.
Allison, we have Allison Smith.
Hi, can you guys hear me? I'm driving, but I have it on unmuted or like hands-free. Just want to make sure that's
we can
okay.
hear you.
Perfect. My name is Allison Smith. I am the Director of Government Affairs for the Global Kratom Coalition. I am based in Washington, D.C. I was actually planning on just listening in, but I think I was accidentally unmuted. But I just have a couple of comments. This is a pretty complex issue, and it's not something that can be divulged or dissected within 2 minutes. I'm more than happy to have a conversation with the board to do maybe some education and answer any questions. That being said, I do want to flag two things. In 2004, the FDA did a single ascending dose study, aka SAD, and it's where they gave healthy adult participants the standard dosage of natural kratom, which was, I think, like 4 servings up to 12, and there were no adverse effects reported. I'm also more than happy to share with you an adverse report study where they found that in incidences where you have again, negative experiences leading up to even potentially death, there's usually polydrug use or a pre-existing medical condition. That's a study that was published last year, and I can follow up after this meeting and send the link to both of those studies, as well as a couple of other peer-reviewed studies for your review.
Thank you. Was there anyone else?
Next, we have Susan Eppard.
Yes. Can you hear me?
Yes.
Hi, I'm Susan Eppard, and I live in Michigan, where my son died from kratom powder, not 7-OH, but mitragynine. My son was 22 years old, and he died from holy kratom powder, the least potent form of kratom available in the United States. Kratom caused him to have a seizure, go into cardiac arrest, and die on his kitchen floor right in front of his girlfriend. His toxicology showed he died from the toxic effects of mitragynine, an alkaloid found only in kratom. He had no prescription drugs, no street drugs, nor alcohol in his system when he died, according to toxicology. His autopsy showed that he had no underlying health conditions. And it is very important to note that my son didn't die from 7-OH or 7-hydroxymitragynine semi-synthesized products, as he died in 2021, long before 7-hydroxymitragynine hit the market in late 2023. And banning 7-OH and keeping kratom leaves legal is like putting a Band-Aid over a bullet hole. It's only a matter of time before kratom dealers go on YouTube and find the process to make 7-OH on their own, and as well as many other spin-off products that are coming from kratom to start the next 4th wave of the opioid epidemic. While it's true that most people who die from kratom have other substances in their system, toxicologists label it a kratom death if the other substances are within a therapeutic range. I've seen toxicology reports with people dying from a combination of antidepressants in kratom, Benadryl in kratom, alcohol in kratom. It's important to note that kratom industry targets the most vulnerable people, such as those with substance abuse disorder, chronic pain patients, and the mentally ill. Therefore, most of these people will just add kratom to the drugs that they are already taking. And kratom already comes from the black market with no assurance of quality, purity, and potency. Over 95% of kratom in the United States was smuggled in from Indonesia, as it's illegal, according to the FDA, to import into the United States.
Thank you very much, and my condolences.
Thank you. I appreciate
So
it.
sorry for your loss, Susan.
Thank you.
Next, we have Dan Gibbs.
You there, Dan?
Can you hear me?
No, we can, yes.
Okay. Yes, my name is Dan Gibbs. I'm from Ohio. Thank you for allowing me to speak. I'm here tonight as a father. I lost my son, Austin, on December 6, 2023. He was 25 years old. Kratom was the only substance involved. No illicit drugs, no prescriptions, no 7-OH present, just my Tragenine from so-called natural leaf. Before his death, I was told the same things being said here tonight, that it's safe, it's natural, and that it just needs regulation. I believe that, and I will live with the rest of my life because of that. After losing my son, I learned far more about kratom than I ever wanted to know. Kratom is being presented as a harmless natural supplement. It is not. It is a psychoactive substance with opioid-like effects. Its primary compound, mitragynine, converts in the human body into 7-OH, a compound that acts strongly on opioid receptors. Supporters often point to small, short-term studies in healthy adults that call proof of safety, but those studies do not reflect real-world use. Real-world users take higher doses, often daily, over long periods of time. Frequently, people dealing with pain, anxiety, depression, or substance use vulnerability. What should scare everyone here? It's not just kratom itself, it's the advocacy around it. Users and advocates repeatedly say kratom helped them get off morphine, oxycodone, heroin. That is not a safety argument. That is a warning sign. If a substance is strong enough to replace opioids, it is strong enough to cause dependence and serious harm. Advocates insist they are only defending natural leaf while ignoring that mitragynine becomes 7-OH inside the body. That distinction is used to reassure people, but biochemistry doesn't care about marketing language. Discussions also rarely include the risks posed by synthetic and enhanced kratom products. Also, I want to be clear about regulation. Regulation has already failed. In states and cities where kratom has been regulated, products remain mislabeled, alkaloid levels vary widely, potency is inconsistent, consumers still do not know what they're taking. Emergency room visits and adverse events have continued despite regulatory frameworks. Regulation has not prevented harm, it has normalized it. That is why I'm urging this board not to regulate kratom, but to ban it in its entirety, not just extracts, not just
Thank you, Dan.
synthetics,
And
not
again,
7-OH. Thank you.
Sorry for your loss, Dan.
Thank you.
yes, thank you. I'm sorry for your loss.
Next is Laura Romy.
Hi, Laura, are you there?
Yes, I'm.
Please go ahead, state where you're from and
Laura?
Okay. Can you hear me now?
yes.
Okay, great. Thanks. So my name is Laura Romney, and I'm actually from Utah. I'm with the International Plant and Herbal Alliance. And I've listened to all the testimonies, and I just have a couple quick comments for you. One thing, I am a 9-year consumer. I've been taking it for my chronic facial nerve pain called trigeminal neuralgia, it's been a true miracle lifesaver for me. I've been able to transition off of all of my opioids and be able to have an actual quality of life again. So it is important to remember that, there could be a few adverse events, but there are thousands and thousands of pain patients like myself that are experiencing relief from kratom. One thing I will say is I know you mentioned how it might be difficult to distinguish between the products in the stores. It's actually very simple. I sent you some information today, so please check your email with some information. I'd be happy to sit down with you and just show you on a Zoom call the difference between the 7-OH products and the kratom products. Again, they're very easy to distinguish on the shelves. And, I encourage you to mirror what the FDA has said. They have said in their own press conference on July 29th, they are not after a natural leaf kratom, that they only want synthetic banned because they do know that there is health benefits from that. So, the FDA would have not said that. That would have been their perfect opportunity to say that we're banning the entire plant, but they're only asking the DEA to schedule the 7-OH or other synthetic products. So again, I just, admonish you to really think hard because there will be collateral damage if you and other cities in Massachusetts pass a full ban. You really just need to take the synthetics off and and regulate adult use only and make sure that standards are set up so that those synthetic products are off the shelf. I really appreciate you letting me speak tonight. And I'm again, open for questions. Feel free to respond to that email. And I appreciate your time again. Thank you very much.
Thank you.
Next is Misty Brown.
Hey, Misty.
Hi, good evening, Board of Health members.
Good evening.
My name is Misty Brown, and I'm with Misty Brown. I'm just a consumer advocate and activist from Colorado. I would like to first off say that the anti-kratom testimonies that you're hearing tonight are not disclosing their conflicts of interest. They are working with anti-kratom trial attorneys so that when their case goes to court, they could say, look, Westford, Massachusetts banned kratom. I also would like to clarify that when someone consumes kratom, the human body naturally converts only a very small amount, typically well under 1%, into 7-OH through normal liver metabolism. The process is slow and self-limiting. From 2008 to 2019, I was trapped in FDA-approved pain pills, benzos, and muscle relaxers prescribed for my degenerative disc disease. I was in active addiction that whole time for 11 years. Chronic pain management turned into a full-blown addiction. What began as a dependency slowly began a cycle of misuse, desperation, and shame. In April of 2019, I was dismissed from pain management after failing a required pill count. I was short on my medication and couldn't find what I needed. Cut off from prescriptions, I turned to the streets. And in that desperation, I slipped into cocaine use while trying to find another pain management doctor. By June of 2019, I was in withdrawal and at rock bottom when I watched a documentary called A Leaf of Faith. That moment changed everything. The next day, I walked into a smoke shop, showed my ID, and bought whole leaf kratom, not synthetic 7-OH. Kratom quieted the relentless cravings, the voice that kept saying, one more pill, one more snort, one more escape, finally went silent. For the first time in over a decade, I felt stable. Kratom gave me the breathing room to heal and allowed me to rebuild my life. I have not returned to pain management over 6.5 years. Today, I'm a thriving mother, a first-time grandmother, and a contributing member of society. I'm no longer a burden to my children. I'm an example of recovery and hope. Thank you for allowing me this time to speak.
Thank you, Misty.
Next is Jen Mercier.
Welcome, Jen. We aren't hearing you.
Jen?
Okay, sorry. I think I'm unmuted now. Can you hear me?
Yes.
Okay. My name is Jen Mercier. I was born and raised in Mass, but I'm actually a New Hampshire resident. I'm just a loud and proud advocate, like Misty, just here for myself. I just wanted to share that, I am a consumer or was a consumer. I used it for chronic pain for a very long time. I'm actually not utilizing it now because, yay me, I don't need it, which I find amazing because it's one of those things that I personally can come and go to it, and take that away from your constituents as an option. I think you just, like Laura said, she has trigeminal neuralgia. There's people that use it in a medicinal way. I've been a teacher and a holistic mentor for many, many years, and I found that it has saved so many people's lives. I have a little bit of an extremist view. I don't think it should be in gas stations or smoke shops or anything like that. I remember when I first found it, I thought that was so bizarre. And the people behind the counter education is key. I have seen it in health food stores, and that's the only place I think it should be. Supplements are also not regulated.
I'm sorry, could you repeat that where you said
it's
where
in
did
health
you say
food,
you've seen it or that you thought
health, it's in health
in
food
health
stores.
food?
Yes. Yeah. So it's not abundant in health food stores, but there are several in our area. And that's where I think it should be, where education or like a dispensary type of situation where people can go and they know what they're getting into. The thing is people have been harmed because they don't know what they're getting into. And that's an unfortunate thing. And with all these synthetics and all of these bad actors, we do need regulations, and we're fighting so hard for it. but to take away your constituents' rights. You know, if I was on the Board of Health, what I honestly would do is I wouldn't allow it in smoke shops and gas stations, but I wouldn't stop the sale online. Or if they are utilizing it, I wouldn't make them criminals. They're not criminals. We're regular people. We're parents. We're business owners. We're friends and family. You know, we're not the bad guys. Thank you.
Okay, it looks like last one is Shannon Harold.
Hi, Shannon.
Hi, can you hear me?
Yes.
Hi, good evening. I'm Shannon. I'm a lifelong resident of Massachusetts. I just wanted to say there are a lot of people out here in Mass, as myself. It's actually terrifying to know that people will suffer in pain if natural whole leaf kratom is totally banned. It doesn't just affect our state, but our whole country as a whole. My chronic lower back pain I experienced before I found natural whole leaf kratom. I cannot even begin to explain what I went through. I am a healthcare worker, and I can't imagine trying to work and do my job in total agony. Please, instead of banning whole leaf kratom, please look into regulating it. Also, I do totally support the ban on the synthetic 7-OH. And I also sent you guys an email recently with my success story and some info on whole leaf kratom and the 7-OH. Thank you for your time. I appreciate it.
Thank you, Shannon. Okay, so at this point, I guess the discussion is whether we'd like to have further discussion about regulation and what we would like that to look like. I think we should definitely have some form of a regulation, so I think we should definitely put that on the agenda for next month. Dr. Gopal?
I agree we should have regulation. So let's put it on the agenda. I don't know.
Joanne?
Yeah, I'm of the same mindset. You know, it's very interesting listening to everybody, and you go back and forth on how much to regulate or how little to regulate. So I think it's a great discussion for us to have. And there's a lot to learn.
Yeah.
My big concern is the kids, though. It scares me that it's so readily available.
And the speed with which things change is hard. Yeah. So do we feel that we have enough with with some of the regulations that are out there to have our discussion based on the information that Ray has shared? Is there anybody else that would come? Megan, you're unmuted. What would you like to add?
Oh no, sorry. I'm just ready. I mean, I think, yeah, to me, I agree with what was said. And I also think that the reality is we don't have the staffing um, I'm regulating it within Westford isn't saying that people within Westford can't
have
access it.
access. Right, exactly. That's sort of my feeling. Michelle, did you have a comment?
Yeah, I was just wondering if we could have an expert presenter, maybe Cheryl Svara or someone else come before us and give us some additional information.
Yeah, that's sort of what I was wondering if Cheryl or anybody local has.
I can certainly ask her if she could come and speak to a kratom regulation. I don't know that she's a kratom expert, but if there's more information that you'd like to see or more studies, we're happy to provide those. And we can certainly poll. We've polled, I think we put 3 or 4 different regulations, what those look like in the surrounding communities, but we can certainly look at all of the regulations that are here in Massachusetts and bring those to you as well.
Joanne?
On that same line, Ray, the ones that we've seen and the ones that were discussed were all bans. Do you know of any that are more complicated, say, regulating by age or product or anything like that? Because to me it gets
Yeah, so
very
right before
confusing, it's just easier. I don't want to
yeah,
say
right
easier,
before we
that's
got on, um there is a community and I want to say I don't know if it's Northborough or Northbridge. I have to double check. So
I
I don't
always
want to be run
confuse.
over with a car or anything, but I don't, there is a community in Massachusetts that has passed a regulation that I believe is there it's a regulation only for 21 or older in specific smoke shops that it's allowed. So I will double check on that.
I did think it was interesting the map that was included in one of the presentations that, showed
And
that.
that was from Linfield's presentation.
Okay. Yeah, that, I asked my exchange student if she'd ever heard of the product, um, being from Germany, and they appeared it when I looked at that map as a banned country. She was unfamiliar.
Yeah, and I think
So
it's important that people understand that that here at the health department and certainly with this board, we try to look at both sides, and certainly we're looking out for the health and safety of all of our residents here in our community. Um, but when it comes to a product that unfortunately is being sold on shelves where people can just pick up the gummies or pick up a liquid shot or pull a soda that has 7H and 7OH, excuse me, in it, um, we have to make sure that we're putting together some kind of protections in place for those folks. Then we don't want anyone to get hurt. So we will pull more information for the next meeting and more draft regulations.
Holly said that Northampton had done a partial ban, but changed it to a full ban.
And I can reach out to them and see why.
That would be great, actually, Ray. That would be helpful. Thank you. Okay, so we can add that then, a regulation discussion next month. And if Cheryl feels that she has something to add or has somebody else she would recommend, that would be great if they're able to join us. Otherwise, we'll have to use, I guess, the information that you've provided and that we've heard and are able to for our discussion. Okay. Then our next agenda item is the Health Department accreditation update. I guess if we're ready to move on.
Sure. So I just wanted to bring to your all attention that we have recently, right before the Christmas holiday, submitted with our accreditation coordinator our readiness assessment. So this is the application for accreditation where they take a peek at everything that we've put together, all 10 domains, and review all our policies and procedures that we're submitting. And then what they do is they come back to you with a score to let you know what's left to be completed before you provide your official application. So that's a 30 to 45-day wait. And so that's the period we're in right now. So we're really excited because the whole department has worked really hard for over a year and a half now on policies and procedures to meet accreditation. It's been quite the process. There's been a lot of significant pros to it as well. Really looking at, for instance, one example is our compliance and enforcement policy, just to make sure we're all doing the right thing and we're citing inspections and violations when it's a standardized form. So just an update on that, and we'll let you know as soon as we hear back. I did want to submit provide you with a copy of everything that we sent in, but it's about 128 pages long, and I assumed you didn't really want to see that or review that over the weekend.
Thanks, Ray. All right, so then we have old and new business.
So a couple things. Just want to bring it to your attention in your packet was the town manager's recommended budget. We have our budget meeting on Thursday night, and I believe Stephanie is coming via virtual to that to support us. We are given budget questions. They come in a couple at a time. And so Friday afternoon, we received about 8 or 9 more questions, which you can see there in the packet. And so we do provide responses. And then any questions that come up on Thursday night at the meeting, we'll certainly be ready and prepared to answer. So if you don't have any questions about that.
No, Megan, were you?
Just, did you, is it beneficial for more people to come, or are we
If
good?
you're able to be there in person,
Yeah, I mean, I can be there in person if that's helpful.
That would be great. The more the
Okay.
merrier. So, it's a strong
well, up to two of us, I think, right? So we're not a
yes.
Forum.
quorum.
Yes.
So yeah, I don't think I can get there on time in person, but if you can, that would be terrific to support Ray.
Okay. I'll be there.
Great.
Thank you.
I just wanted to thank Ray for the answers to the questions. I read through them all, both the FinCon and the other series of questions, and you did a great job. Some of them
Thank you.
didn't know why they were being asked or the relevance of them, but
Maybe it's
and,
a concern about finances to support some of those issues if they come up.
maybe, I guess, but you did a great job. Thank you.
Thank you. Vaccine confidence webpage. So that has been posted to our health department site. We are going to put a link. We just received it this week from the Department of Public Health. They have put together a social media platform that has all of the advisories that has come out in the last 2 weeks. And so I think that's important. What's been difficult is as part of those advisories, they're clinical advisories. So they're advisories for school nurses and our community healthcare facilities in the area. So some of the information I think isn't so relevant to the public. So we have had to separate that information out this week, and we will add that to the vaccine confidence page. But if there's anything specific that you would all like to see, or Ray, can you add this? We are happy to do so.
So I just wanted to make sure. So this is live. When I'm going to look at it, am I in the right place? Under home departments, health and human services, health department, vaccine information. Is vaccine information, is that the main page on Westford Mass? Is that where I go to? Or can you
Abby,
send me a link?
can you just double check that for me? I have so many screens going. Let me see. Yeah, let's just bring that up. We put it Abby and Marissa lined it up so it's on the left side when you bring up our health department page. So it's a main topic area so that folks can find it. Hopefully, you hope they can find it quickly.
Health department. Okay. And then on the left, you're saying?
Yeah, and it's
Very
alphabetical
bottom,
order.
vaccine information.
Vaccine.
Yes,
Yes,
vaccine
that
information.
is where I was. Okay, cool. I will take a look at it. I will not go on and on like I always do, but it just seems like every month things get worse at the federal level, and nothing changes from the scientists or the physician health organizations. And I was checking, so we're not putting anything then that links to the CDC, correct? Because they're just putting out non-evidence-based information. Is that correct? I'm not seeing it.
On this page, there is nothing linked to the CDC. We are
Okay.
still working on this hundreds and hundreds of
Yeah.
embedded information because it's not just the CDC for vaccines, right?
Yeah.
It's the
No,
CDC for pools and it's the CDC for and
no, I just meant for vaccine.
yes. So just for vaccines, on this page, no. But if there's anything, like I said, that you want changed or added or taken down, just let me know.
While we're on this, can I ask you if this is something that should go on like a new business next time? But if we at all need to address the changes to the food guidelines that are not evidence-based, is something that is on my radar now. And also, should we ever be talking about anything to talk about how interactions with ICE agents lead to dangers to health?
I would say if there's anything that you'd like to put on the agenda, to let Stephanie and myself know, and we'd be, happy to do so.
That sounds good. Just let me know, Dr. Gopal, and we'll get that on there. Joanne?
I have a request. I was just flipping through the health page too. Um, the vaccine information, at least if I'm in the right spot on the left-hand side, it's the very last. I understand it's alphabetized, so it would be very last. If you could put something in the body of the the homepage for the health department, like where the mosquitoes are now, because we don't need, I know, I understand. Nothing goes up and down immediately, and everybody's busy, but that would be a really, I think, advantageous place to put something of this importance, kind of right there, so that people don't have to search all over and they can see it right away.
It's a good
We
idea.
can certainly do that. Yep, we can certainly do that. And we have linked it as well on our social media page, which I will keep continuing to do. But I can certainly ask Marissa as Abby goes out if we can, shift,
Yeah,
add it
just
to that
escalate it
section
up
as well.
so that it
Yep.
becomes more,
Yeah, we can easily just put a
for
link
attention.
there to it too.
Yeah.
In regards to that, just understanding, because overall I did see that it was alphabetical order, but then as I look more closely, like Ask the Nurse is an A at the bottom and BSAS is a B at the bottom. So I don't know. And CBD hemp is at the bottom. So I just didn't quite understand where that alphabetizing sort of broke down that got to push vaccines even further down.
Yeah, I will double check with Marissa. She's our admin that does our social media. And when she built the page, I asked that it could be alphabetized. It's never been alphabetized, the left portion. And it's kind of as something comes in, it's the first thing at the bottom. And so asking her to do so, if that's not the case, then I will certainly make sure that's corrected.
Yeah, it looks like maybe a little updating on the alphabetizing would be
Sure.
in order.
Still going to be at the bottom.
Well, but at
Correct.
least people, hopefully they hear us, they can go to the very bottom, but if we get a link on the page too, that would be helpful. Bottom's easier than the middle. No?
Yes. I was just thinking how I could get it bumped to the top by calling it like a vaccine information page or something.
And we
I'm
can
sorry.
certainly put something at the top that says new topics.
Spotlight
Or
or
spotlight, yeah.
Something to that effect. We do not have a web page manager or social media
Oh.
manager. You're looking at her. So Abby is so good at it. And so with her going out, let's get it the way you want it. So I would say if you want a spotlight and you want it at the top, we will certainly do so.
That might be a great thing. Either that, or if you get it on the, on the right and on the left.
We will.
the body.
We'll make sure it's prominent.
Yeah.
Cool. Thank you.
Okay.
Sure. Okay, so next thing is Ask the Nurse is the monthly write-up that Gail, our public health nurse, does each month for WestfordCAT. This month is social determinants of health, and so that goes to each home in a printed form. And so just wanted you to be aware of that topic. We have Heart Health Month, which is February, so we have a few events going on for CPR courses. As well as first aid. We have hands-on CPR, which is extremely popular, especially with our youth and families in town. And we have BIT, which is Buried in Treasures. And the class has 2 spots open. It's almost full. So that's pretty popular at 15-week course. Addictive behaviors, that's still taking place at the First Parish Church, which is proven to be pretty popular. That's a meditation course for any recovery addicts. And so that is at the First Parish Church on Thursday nights, 4:30 to 5:30. We have the accessory dwelling unit. That's a brand new presentation, ADU, for residents. It's taking place at the Cameron Senior Center. The Health Department, Land Use, Zoning, and Building myself are also presenting as a panel and providing all kinds of information for residents on ADUs. It's proven to be quite popular these days. Pathway to Local Public Health. So that is a new program where we are taking on a student through the Department of Public Health who is a community college student. Her name is Sophia. Bozoid, and she starts close to the end of this month. We have a memorandum of understanding, an MOU agreement that's in front of the select board tomorrow night for our signature. And so that student will be with us for 9 months. There's a Pathways program where they set up information and trainings for them, onboarding for a pathway to local public health. So we're happy to be a host agent for Sophia and looking forward to having her start. We'll have her, she'll be in the health department about 2 days a week, and the rest she'll be in training, getting
Is it
her
a paid or
certifications.
unpaid internship or?
That is a paid internship, and the health department receives $10,000 for taking on the student.
Nice.
Opioid settlement funding, key interviews. So right now, the opioid settlement task force has been looking at, as part of the program with this funding, you need to make sure not only do you survey your community, and that survey has since closed recently, but you need to make sure you're interviewing not only residents in your community that may be in recovery or may have had any kind of opioid pathway. And so we have been meeting with what's called MAT programs, medication assisted programs here in Greater Lowell that service not only the surrounding communities, but service Westford residents. We've also been meeting with recovery coaches and different programs that are being offered to Westford residents. The continuing continuity program through the police department, and collecting other data sets for the opioid settlement. We want to make sure people have died for this funding, and we want to make sure that it's going to folks that actually need the assistance, the coaching, the training, the help, the resources, whether that's paying for, a recovery or program spot. So I just wanted you to be aware of that. We've had lots of people ask questions about, in Westford, we've had 8 opioid related fatalities, and so, incidents, and we want to make sure that we're addressing that. Every month we let you know what new food establishments are coming to town, and we have Pierre Grill, which is a Mediterranean, it's been a long day, Mediterranean food restaurant on One Land Drive. So we have our staff has just opened that facility, and we have just approved the food establishment application for NVIDIA. So we're waiting on that. So just want to bring
For
that to your attention.
NVIDIA?
NVIDIA, Abby, is it a corporate kitchen?
Yeah, it's a corporate kitchen. NVIDIA is like a large, I guess, tech
I was
type
gonna say it
company.
sounded more like a tech company
Yeah,
than
it is. Yeah, it's a
that
kitchen for
makes
their
sense.
employees.
Nowhere we're going to dinner, right?
No.
Because,
It looks
we're
nice
the
though.
corporate. It does. And then the last item is we have funding that's available for everyone who wants to take it here in our department, professional hoarding certification. And so we do have 4 staff that are going to be taking that extensive course to receive their certification in professional hoarding.
Oh, that's great.
Yeah. So that'll be really helpful with some cases we have here. So
Okay. Well,
unless you have questions for us, but that's pretty much it.
okay. Well, we'll say goodbye and good luck to Abby. Won't see you for a while. Hope everything goes well.
Thanks.
I second that motion.
Ditto.
Thank you.
And I guess, do we have a motion? I'll make a motion to adjourn. Is there a second?
Second that motion as well.
Okay, motion made and seconded. All in favor, Joanne,
Aye.
Stephanie, aye. Megan,
Aye.
Stefan,
Aye.
and Michelle.
Aye.
Great. Thanks, everyone.
Aye,
Thank you.